I know there are providers out there thinking about notifications creating more work for them to address. Can you help us think of how organizations might reduce that perception of additional burden?
Yeah, there's some practical steps. Absolutely, it's a concern, and it was a concern immediately as the consensus body came together. Is how do we make sure we're minimizing the impact and maximizing the effectiveness of how they receive event notifications? And on the receiving side, all the way down to that care team and the organization and so forth, are implementing a very practical step is to make sure you reviewed your direct addresses. Today, there's a list of direct addresses. Of a lot of them have been assigned by providers, or they have certain workflow addresses. But really, you want to make sure that the direct address that you've published, or direct addresses that you've published for this, are made aware and published to the national directory through your EHR. But you've also communicated them to the community around you, to the most likely places that you will receive event notifications. So the health systems in your area, the hospitals in your area, make sure that they know how you want to receive and where you want to receive on behalf of your providers.
Yeah, I think, Anupam, there's two areas here to think about this. Number one, on the sender side, are the right fields of information being supplied to allow for effective filter? Filtration is a very important aspect of keeping the noise down. So we want to make sure that senders are committed to populating the event notifications with the right information to support filtration. And then on the receiving side, as Teresa said, organizations need to look at their inbound information and say, do we have the right addresses for our organization? Do we have the right addresses for our departments? Do we have the right addresses for these different purposes of use? And these are addresses that are a design decision around how you're using direct. We all know that trusted identities are the foundation of what makes direct trust special. And trust is the limiting factor for how quickly we can drive interoperability. But with that said, individuals who are trusted within the network need to have efficient places and effective places where they can get access to information or be protected from receiving information that really isn't relevant. So that combined factor of making sure that you have the right directory design structure is an important side on the receiving side from just having noisy events. And then on the sending side, it's really about commitment to supplying the right data that really supports the right filtration.